We'll see if this is the right button. The other way. All right. Hello, I'm Rachel Ballard-Barbash. My undergraduate training was actually in natural resources, and then I went on to medical school, so it's quite interesting to be in this room today and hear a lot of the issues and debates that I heard 30 years ago when I was at University of Michigan. What I'm going to be covering is to talk about a model for how people across the federal sector have collaborated to try to move research forward in an area related to child health. But specifically, there was an effort by this group to look at environmental factors that we know influence health at a population scale. So the effort I'm going to talk about is a national collaboration on childhood obesity research. And this really came together about 8 years ago when Robert Wood Johnson announced its commitment to help to reduce childhood obesity. And because people really drive everything, the head of Robert Wood Johnson, who had trained with the heads at that time of NHLBI, the National Heart, Lung, and Blood Institute, and the National Institutes of Diabetes and Digestive Disease and Kidney Diseases, got together and said, could we do collaboratively? And this was the effort that would move forward. And about a year later, we joined USDA with this effort because this represented the 4 largest funders in this space related to childhood obesity research. What we are trying to do in this area is to build knowledge, to work across sectors, and launch new ideas and accelerate dialogue and action, which is a lot of what has been discussed today about this effort moving forward. There are really 5 mission areas under the National Collaboration on Childhood Obesity Research. One of those efforts has been to really identify, design, and evaluate practical and sustainable interventions, particularly those that focus on high-risk populations and communities, because unless we deal with improving problems where we've identified disparities, we will not make our goals in terms of health at the national level. Another was to really try to improve surveillance. By that we mean the data that we need to try to understand at the local, state, and national level where we're making progress and where we're not and how we can move forward. And to really try to improve the ability of researchers and program evaluators to do population-level research, to conduct this research and program evaluation. And then finally to provide leadership to accelerate implementation of evidence-based practice and policy. So those were our efforts initially. And about 3 or 4 years ago, we added a 5th effort, which was to work with what we would say non-traditional or non-health partners to actually integrate these efforts with other types of activities in environmental design and sustainability, food systems, marketing, disabilities, economics. So I wanted to talk about an effort that workshop on building sustainable schools for healthy kids. Matt Trowbridge helped in leading this effort, and it was to bring a diverse group of participants to talk about how environmental design strategies can be used to promote physical activity and healthy eating. And the first speaker gave a wonderful description of just how tremendous a progress can be in that area. And there was a workshop report that was produced about 2 or 3 years ago, and that has been actually very useful for a lot of schools and programs who are trying to figure out where they might move in this space. It stimulated a number of activities, surely not that alone stimulated because there is a movement in this country to deal with this issue, but groups who worked in healthy eating design guidelines for school architecture and developed a video. There was a article led by Matt Trowbridge on public health and green building industry and partnership opportunities for childhood obesity prevention. And there has been a lot of discussion about the potential for joint training programs, and Esther spoke about one of those, in an effort to build a measures registry and have metrics of built environment. And this has been a big focus, of course, across both the federal government, but Robert Wood Johnson now is increasing their attention to how we look at metrics, not just for built environment, but a whole range of issues related to health. One of the things I wanted to talk about is the potential to actually move forward with funding in areas that we think of, not actually think of as typically a big focus within NIH. And this is one effort that is a rapid funding research mechanism to study the influences of built environment and other changes in the food environment on physical activity, diet, and obesity prevention. So this type of mechanism has been used by NIH for over 20 years to study infectious disease epidemics, to study natural disasters, but had never been applied to trying to study this question. So a number of staff at NIH worked to try to better understand how that mechanism could be used, and a program announcement has gone out in this area, and these are examples of two studies that were funded through this, one on impact of zoning code reforms on the built environment and physical activity behavior, and the impact of environmental changes on children's BMI and behavior. So again, this is trying to link the data on changing the environment, changing could be applied to buildings, to actual measurable data on health outcomes. I would say this is a relatively nascent area because it's pretty hard to link those data, but we're moving forward in this space. Another effort was a group, Johns Hopkins University is the awardee focusing on Global Obesity Prevention Research Center, and that effort actually provides modest funds to enable researchers to collect follow-up data and evaluate policy environmental changes, because one of the big problems in this space, the first initiative was to allow people to get the baseline data to just at least characterize what's happening before an innovation or a change occurs, and then there are other NIH mechanisms that allow people to get longer-term data in this area. One of the things that I hadn't included on this idea of novel funding mechanisms is there's been a huge effort to study the questions of looking at system science to understand change at a large scale. And a lot of the discussions today about how do we look at the effect of things that may have a very high hazard ratio, and then how do we actually look at the exposure. So I think this is an area where this field could move forward by actually thinking about how to apply system science to quantify the actual effect of the different changes being proposed. This is just to give you a sense of why the rapid funding mechanism that NIH supports in a few areas of science is useful. Typically, it can take about 12 to even 18 months to put in an idea to NIH to actually have it funded as an award. This rapid funding mechanism is much shorter. It's only a 6-month process. So this is something that may be very useful to think about in moving this area forward. And this just provides some links within this national collaboration on childhood obesity research that address topics in this area. One of the things that we have moved forward through this initiative is when any of the funders have a funding initiative to study efforts in this space, we actually put it up through NCCOR, and then each of the partners disseminate it to their investigative group. So this is actually a very good resource for people trying to understand what might be available in this space. And we have, in my view, a very modest effort related to built environment, but related to NCCOR, but I anticipate that it will continue to grow.